Morning, everybody. I think we're just going to get going. Thanks for joining. Thanks for joining this call. I would like to start by introducing the team that is going to be leading this discussion. Myself, Hannah Casey, who is our senior consultant based out of Toronto, who is our senior communications advisor, as well as Ian Chesney, who is in Ottawa, also senior consultant, working on a lot of federal and pan-Canadian files. For those of you that don't know Santis Health, thank you for joining. We are a public affairs, strategic advisory, public policy, marketing, and communications consultancy. Simply put, we focus on healthcare, and we focus on healthcare in provinces and at the federal level, and we enjoy doing so thoroughly. So today we want to talk more on the federal angle, but we're going to talk about some FTP relations, FPT relations as well too. We want to focus on what's kind of making it into the news, what has made it into the news over the past year, do a little bit of a comparator because we did a similar exercise this time last year, almost to the day. Let's talk about the current environment, the impact of wave one, and then how all of that is driving healthcare policy, politics, and priorities. So with that, I'm going to flip it over to Hannah.
Thanks, Peter. As he just mentioned, we had a similar webinar this time last year where we looked at the priorities heading into 2020 and what was making news at the end of 2019. And the three common themes that we saw time and time again were Pharmacare, the opioid crisis, and vaping-related illnesses. So on the next slide, we pulled this directly from last year's webinar, and this is more anecdotal than analytical or based in data of any sort, but we have seen Pharmacare and the opioid crisis pop up in our news scans over the past year, but really interesting, the vaping-related illness topic or issue has really quieted down and fallen off of radars over the past year. So this is a bit of an overview of those three issues from October of 2019 to December of this year. And we use Google Trends to pull this info. It's a really powerful tool that allows you to look at Google queries and keywords and map it out in a geography and over a certain time frame. So we mapped out these three keywords, and I assumed that as soon as COVID hit in March, the three of them would just completely plummet in terms of relevancy and conversations in the public sphere. But interestingly, particularly with Pharmacare, the conversation remains ongoing. And of course, we see some peaks when there's key political milestones or key stories that pop up over the course of the year. Another thing to note looking at this slide, the Angus Reid poll, for example, found that 86% of Canadians supported some sort of Pharmacare program. And just as quickly as the public gains interest on an issue, it drops back down in interest just as quickly. So it really shows the cyclical nature of our news, as well as really the short-term memory of the public and Canadians, which I'm sure isn't new. The big elephant in the room, however, is how COVID impacts these three themes and these three issues. So we mapped out COVID on top of those three themes using the same parameters and the same search queries. And it, of course, just completely eclipses every other conversation because it is, of course, the newsmaker of 2020. Again, we see rises in interest and relevancy as significant issues or milestones occur. One thing that we found particularly interesting looking at this slide is the throne speech. If you remember, that evening Trudeau gave a public address to Canadians, and it was really intended to be a bit of a level set, kind of intended to shock us back into public health measures as wave 2 was on the horizon. And it didn't, in fact, necessarily cause an increase in public awareness. It actually plateaued. So it's interesting to see how the COVID fatigue is present in this slide, and it'll be interesting to see maybe 6 months, a year from now, how that vaccine line will likely skyrocket, because that's obviously top of mind heading into 2021. The next slide is another slide that I pulled directly from last year's webinar, and it's really intended just to map out and showcase how each of the provinces are dealing with their own regional and local healthcare issues. So a year ago, the federal government was dealing with their own mandates, their own priorities, but at the same time, they were also bogged down by all of these other provincial issues that were taking their attention away from national initiatives. In contrast, when we look at 2020, of course, and I'm sure this isn't surprising, each province is dealing with their own COVID-19 case counts and realities. So we're in this really unique period where all of the provinces are dealing with similar issues, asking for similar supports from the federal government, which is unique when we look at just a year ago. And it also is a good reminder that all of those issues from 2019 haven't been resolved. They're still outstanding. So the next year will be really interesting and really challenging for all levels of government as they handle vaccine rollout and ongoing COVID cases, in addition to everything else that just sort of fall into the bottom of the priority list. So with that, we've taken a bit of a look at what the public has been watching and thinking about and searching in Google. So I'm going to turn it over to Ian to actually talk about the first wave and its impact.
Thanks, Hannah. So we're going to start off by going over a bit of polling with respect to at the political level. What are the polls telling us, and how is that a bit of an indication for what's to come potentially in the future? So this is data from Abacus, and we went over this in our last webinar where we tried to give a bit of a snapshot in time of where kind of public opinion is at with the various different federal leaders. As you can see through this, the Liberals have held a pretty strong lead throughout much of the pandemic. It hasn't really changed all that much, even with the WE scandal, other challenges on top to boot. They've held a pretty consistent lead, and I think that is really where you're getting the rumors and indication that an election is likely around the corner, and that the Liberals will want to take advantage of that lead at some point in the future. But it's also important for us to take stock of what matters to voters right now, and does COVID and the government's response to COVID actually matter? And based on, I think, what we're seeing in some polling, particularly Abacus, we are seeing that it matters, that this is a deciding issue for voters, and it is important for them. And I think that's a good indication that ultimately, when an election does happen, whether that's in the near future in late winter, early spring, the government will be judged on their handling of the pandemic, and that is going to be an important factor. And opposition parties will try to capitalize that by finding areas where they feel that the government has faltered in their pandemic response. So, but what about the impact of wave one in terms of its direct impact on the healthcare system? And this is going to really, I think, set the context for how the areas that governments will need to respond to in future as they look at the healthcare system overall and the challenges that COVID has created. So, I think it's first important to point out that, we saw huge transformation of the healthcare system as a result of COVID. And usually when we think of transformation, we think of transformation over years. What we're seeing is transformation over weeks or months. So this is really unprecedented in a lot of areas in the health system. So a lot of this data we're going to be going over is from the Kai-High report that came out in November, where they went over the impact of wave one, which is largely data from the spring, so around the kind of March to June timeframe. So some really interesting stats that are already coming out is obviously there was a big shift in virtual care. Physicians were providing 52% of their care virtually. That included online, phone, psychotherapy, consults with other physicians. And there was also, so that was maybe an optimistic shift or a good shift in terms of the health system, but there were also challenges that this created in terms of how hospitals had to prioritize for, of course, the most urgent patient concerns or surgeries, which we'll talk about. So on that vein, what was the downside? I mean, we saw huge shifts with respect to inpatient occupancy and changes. And this shows, this graph here shows you the change from 2019 to 2020 data. And as you can see, right when restrictions came in March, there was a huge downshift in both inpatient occupancy and the number of surgeries actually being performed. And we'll come back to surgeries in a second. And even after restrictions started to be lifted around May and June, that backlog will take a long time, particularly on surgeries, to fix itself in the system. So, but there were other areas beyond just beyond surgeries and just kind of that overall look at the impacts to hospitals. We saw huge impacts to home care. There was a 22% reduction in initial home care screening assessments in April. That was right at the kind of the peak of the first wave. We also saw a lot of non-urgent home care visits being canceled. That obviously has a huge impact. There were tons of impacts in primary care. Of course, as everyone will recall, there was a lot of restrictions put in place in primary care and paramedicine, where regulators told the profession that they should not be providing, or they should only be providing urgent or essential care. As time goes on, conditions that maybe were not so urgent or essential early on rapidly become more so, and that's going to create huge impacts to the system as well. And we also saw a huge decrease, of course, in visits to emergency departments overall. And in April, that was about a 50% decrease. So we touched on surgeries a bit, but I think it's important to come back to that, because this is going to be a huge impact that is going to take a long time to fix itself. And it's something that you're hearing a lot about in the media. For context, there's been a lot of statistics thrown around about the surgical backlog, but in Ontario alone, from March to June, the backlog was around 150,000 surgeries, and that's just Ontario. Again, these stats that you see on the screen here, these are of course cross Canada based on some CIHI data. So for example, there was a 17% decrease in urgent surgeries. So that includes surgeries such as bypass surgeries, cancer surgeries even. That's very significant, of course, on the health system and patient outcomes in the kind of months and years down the road, depending on their condition. A 67% decrease in hip and knee surgeries, and an 80% just overall in terms of less urgent surgeries. And so this backlog is huge, significant in the healthcare system, and is going to take a long time to fix itself.
Maybe we have a couple polls going on throughout, and why don't I end this poll here now, because it's probably the right slide to do it. And I'll share the results. We asked you, and for those of you who work at CIHI on the line, you have an unfair advantage. But the results are up on CIHI's website if you want to see what essential or non-essential surgery saw the greatest decrease. A friend of mine at CIHI was talking to me about these numbers, and I got tricked. As a percentage, vasectomies went down the most. As sheer numbers, you're looking at the other higher use surgeries like hip, knee, cardiac, or hip, knee, and cataract. So you can go online and see, but there's a lot of interesting data on there that for health nerds, you probably would love to look at, like I did.
So what does this mean overall? How is the system going to have to kind of deal with this challenge in the future? For context, again, using Ontario as an example, there's predictions that it will take almost 2 years for the surgical backlog to clear itself from wave one. So that's if the system is dealing with that for the next 2 years, that's a huge indicator of the challenges and areas of needed investment that the health system overall in Canada is going to need. And that makes us think about, well, what is the system going to need going forward? And in many ways, just as we saw with schools, a safe restart agreement in June, I think a similar, Peter will talk a bit more about the FPT implications, but a similar kind of FPT negotiation or investment is going to be needed to address these kind of challenges that are more about the kind of post-COVID challenges following wave one and the impacts, of course, of wave two, which we're only experiencing now. And as we've pointed out, the impact goes well beyond hospitals and primary care. I mean, we didn't spend a lot of time in those last few slides talking about long-term care, but as we've seen, COVID has really exposed long-rooted systemic issues in the long-term care sector that with respect to the staffing shortage and the state of of long-term care infrastructure across the country. These are issues that are going to take a long time to fix themselves, and COVID really only just exposed areas where the system needs more investment. Obviously, mental health, COVID has put a huge strain on people's mental health. And we're seeing a lot of impacts in that area, and there's going to be a lot of needed investment going forward. So now I'm going to turn it over to Peter. He's going to talk a bit forward-looking in terms of what the implications of these challenges are for the federal government looking forward, and in terms of their relations with the provinces.
Thanks, Ian. Thanks, Hannah, before that. I should say before I start, there is a Q&A button that you can click and you can ask questions. We're doing our best to answer through it, but we'll have time for questions at the end as well too, and we can respond to them in writing or verbally. We also have a broader Santis team on the line here as well too, so that way we can help get support with questions that Ian, Hannah, and I may not necessarily know the answers to. So ask away. And I think, Hannah, there might be a survey that we're going to send out after this too. We'll throw that in the chat if we are doing that still. So what do we need to focus on first and foremost as a country? The first priority is the vaccines. If we don't get this right, it's really hard to imagine that anything that Ian talked about or anything that we need to do on the poll right now can get addressed. Government's number one priority is effectively rolling this vaccine out, so not just the economy can open, but frankly, the healthcare system can open. And there's a couple markers that the government has now put out there in order to test whether or not they have met their objectives. They've clearly stated that the majority of Canadians will receive their vaccination or their COVID-19 vaccine by fall. So let's say, for argument's sake, end of August, we should have more than 50% of the population that wants to have access to a vaccine to get it. And in doing so, they need to have all of the logistics deployed. They need to have the public health communications campaign to encourage people to get it. That will be a marker. And I would argue that governments will be punished for not doing this well, but at the same time, if they do it well, it doesn't necessarily mean that they'll get a boost for it either. You would think they might, but I don't think it's guaranteed. So moving past vaccines, if they do that right, what's on the list from a policy perspective? The Liberals have a number of things that they said they wanted to do pre-COVID. Some of these things we've heard reiterated in the past couple of days in the throne speech and the fall economic statement, whether it be Pharmacare, funding for family doctors, national standards for mental health, home and palliative care, a strategy to address high cost rare drugs. And just to put a finer point on that last one, people shouldn't get confused with a rare drug strategy. The government is being very focused on pricing for the past 4 or 5 years. And I suspect that same principle that they brought to, say, the PMPRB, they will probably bring to how they look at rare drugs, where they're going to focus on the highest cost ones. And it's unclear what they mean, a strategy to address high cost rare drugs, but they're imminently supposed to be announcing their strategy forwards, or their strategy to have a strategy. What things have been exposed, and this is what Ian has talked about, and we have a bit of a provocative question up on the polling right now. We know a number of things likely need to be addressed. There is a massive backlog in in diagnostic and treatments. There's a huge HHR resource issue that crosses long-term care and home care, and they are intricately linked in that challenge. Mental health care is without a question emerging. If anybody listens to the Hurley Burley, I highly suggest go listening to Adrienne Spafford when she was on a guest on the show 2 or 3 weeks ago, that really tells the story of mental health in Canada and the impact of COVID. Long-term care infrastructure has been an issue for years, and it's just being brought to the fore even more, and the attention it probably needed to get. Unfortunately, it's getting it in the most tragic of ways. Public healthcare modernization. Public health has been an area that governments just have not invested in, liberal and conservative alike, and now we're paying for it. And then PPE will be an ongoing issue because we will constantly need those supply chains from here on in, and infection control. So the question that we put up on the polling is to try and ask if they had to do one thing well. And I'll go back to the Dalton McGuinty days. Governments generally, if they focus on one thing, they can do it well. And Dalton McGuinty in the early days focused on healthcare, and the later days focused on full day kindergarten. And when you're looking at the issues that you see in all of these healthcare priorities, it's obvious that governments need to figure out how to walk and chew at the same time and do more than one thing at the same time. It's going to be challenging in a healthcare system to look at the fundamental reform that's needed in multiple aspects of the healthcare system and the relationship between provinces and territories. I'll end this poll, unsurprisingly, and obviously this is not statistically relevant just because it's our fun little group here, but it's still fun to look at. Not surprisingly, long-term care punches to the front, and Pharmacare with one response. And I think we're starting to see this dialogue emerge when the Prime Minister is talking about his relationship with provinces and what the feds are interested in. It might not match up with what is actually needed on the ground, or what is needed by provinces, or what provinces believe they need. So the fall economic statement, I personally don't think the fall economic statement was what they intended it to be. I don't think this government believed it was going to be, this federal government believed it was going to be so dramatically in wave 2 in the way that it was. I think the government, 3-4 months ago when they did the throne speech, had hoped to be talking more about the environment, had hoped to be talking about more of their priorities beyond COVID and healthcare. And the reality is that that just wasn't possible. So the fall economic statement had a couple big markers, which is there'll be $100 billion into stimulus. We'll need to follow the money on that one and become procurement experts in terms of how that funding can be accessed. We're going to have more funding for health transfers, which we'll talk about in a second. But from a moving the yardstick forward on the things the government said they cared about, the only thing that they committed to imminently launching is a national strategy for high-cost drugs. And on that, it's again, the strategy to develop the strategy. So it's very consultative based. So not a lot in the fall economic statement. And the reality of that is that they need to get vaccines right, and provinces need support in wave 2. So this brings us to yesterday's meeting. I was not surprised that there was not a particular newsy announcement that came out of yesterday. In fact, the only tangible announcement came out that the federal government's going to have a compensation fund for those that the rare circumstance that somebody may have an adverse sorry, I'm losing my train of thought. It's for those that have an adverse reaction to a vaccine. So provinces are going to say they want more money. Federal government is going to say we want conditions. I lived this in 2015 to 2017 when we went through the last health accord, and many others lived this in 2004 when the 6% escalator came in. Right now, funding for health transfers are increasing every year by 3% or GDP, whichever is greatest. The Conservatives got that in place. This Liberal government loves that because it answers the question. And then in 2016-17, over and above that, specific funding was targeted to specific things. It's likely that the government will want to try and get there. Provinces will act upset. They will act aghast because they're going to demand the federal share of healthcare go up to 35%. We could have a whole webinar just on health transfers and the politics of it. And I would love to do that actually, or even have that conversation. Interestingly, the Prime Minister made it clear yesterday 3 different priorities. 1, Pharmacare. Again, interesting, especially considering, does Pharmacare rank as the most important thing right now compared to what else is happening in the healthcare system? 2, long-term care, which very much aligns with the thinking of this group based on that poll. And 3, virtual care. And Ian touched on this in terms of the switch to needing to access virtual care in order to access the healthcare system. The PM did say that they will provide new increased funding for health transfers, what the premiers did like. There's a caveat there. Of course, they're going to provide increased transfers. It's locked in that they'll give 3% more. So the question is, how much will the PM put in the window for Pharmacare, long-term care, virtual care, and any other priorities that the provinces like? And if you go back to the first slide in terms of what the government's priorities are, they committed to $6 billion in new funding as a down payment for a lot of the things they want to do. That funding hasn't necessarily been identified either. And this is over and above, and the PM loves referencing this, the fact that 80% of the spending that's taken place from COVID is with federal dollars. So what does this government want to focus on going forward? I would say 3 things. They need to get the outbreaks under control and support provinces in wave 2. And the reason why yesterday was the conversation is that there are so many provinces that are facing more significant outbreaks now than they were during wave 1. It wasn't the time or the place to be talking about futuristic policy principled objectives. 2, there needs to be recovery, and there doesn't need to just be recovery for the economy, that $100 billion in stimulus. There needs to be healthcare recovery as well too. Again, leaning on that high data in Ian's presentation, there is a significant backlog, and that was just wave 1. That doesn't even include what the impact is in wave 2, though it will be interesting to see how the hospital sector in particular adapted to a second wave, because wave 1, they just shut down right away. Wave 2, they might be able to handle it a little bit more, but we'd be kidding ourselves if we didn't think there would be an impact. And then the third thing that the federal government will want to do is go beyond their COVID-19 and what are the things that they want to achieve? What are their principal policy positions like Pharmacare? Where do the Conservatives fit into all of this right now? And we have a couple smart Conservative folks on our team that I asked this question before building the slide. And the reviews on Aaron O'Toole and the Conservative Party right now aren't particularly positive. Aaron O'Toole, coming from Oshawa, Blue Belt community, had some really good ads out of the gate, framing up who he is and what he stands for. Has really gotten lost in the vaccine debate with a couple of their social conservatives in their caucus, and somehow O'Toole trying to turn that around onto the Liberals. It's just odd. The MAID bill, I would say, was a little bit of a flare up, and the Conservatives folks on our team highlighted that. Interesting how much they fought that bill, especially because it's a court order and a court deadline by December 18th that they need to meet. And this is legislation that was initially tabled, I believe, it was before COVID. So I think it was initially tabled at the beginning of this year, or the tail end of I think it was the beginning of this year. So it's not new legislation. And yet they're quiet on things like long-term care standards. The Conservatives haven't found their recipe to effectively take on the government yet. And the other parties aren't doing as well, frankly, either, except for the Bloc Québécois. I think the Bloc Québécois have the strongest position of all the opposition parties, but they kind of know what their mission statement is and what they're focusing on. The NDP are fighting for their relevance, and they're also going to be really concerned about a new charismatic Green Party leader who's going to be looking to siphon off those votes from the NDP. Whether the NDP likes it or not, that's the dynamic they now have to play with. So the NDP are actually in the position where they're fighting on both ends of the spectrum between the Green Party and the Liberals, which is actually usually what the Liberals are used to doing. So I saw Manny was asking this question, so I'm gonna throw this question up. Is an election going to happen, and when is it going to happen? The chance of a snap election, it was really interesting seeing what happened this fall. And when we wanted to do this webinar, we waited a bit, but you'll remember a couple of weeks ago how it was quiet. Then all of a sudden we were going into a week of, oh my goodness, is there going to be an election? The Liberals, I think, very deliberately let things go to the brink because the Conservatives and the opposition parties were banding up together, especially around We Charity. They're trying to dominate the agenda. And the Liberals had to assert their control in Parliament in order to allow for their agenda to go through, or they were just going to get steamrolled by the opposition that has the majority vote on committee. and frankly, the Liberals had to push it to the opposition to basically say, listen, either we're the government or we're going to an election. We're not going to be a passive government that allows you guys to whip us around. And that was the dynamics that took place a couple weeks ago. But it's a reminder to show how in Parliament you can start on Monday on the outside where we are here, or the quasi outside, I should say, and think everything's calm. And by Thursday, you're going to wonder if there's an election by Friday. That could happen. The big confidence vote is going to be on the budget, though. And I would say that there'll likely be the possibility of spending bills prior to the budget, because this government's been putting spending bills forward every so often. So there's a chance there could be spending bills prior to the budget, which would be a confidence vote. You just like the fall economic statement has that confidence vote around the new spending that they're putting in place right now. But I think everybody's looking to that budget. And there's a couple different ways to think about it. One, if I were the opposition, I wouldn't necessarily want the Liberals to get to a budget, because it allows them to lay out a plan and allows them to dominate the media cycle. Two, they get to the budget, the Liberals are fall on it and they have something to run on. And I don't know if you saw Blanchette yesterday about the FPT discussions, but he basically said Trudeau's just trying to get to the budget so we can claim that you have to vote for me to get money. And that's probably true. The third thing that could happen is the budget could come along and the NDP could see enough spending in there on things that are a priority to them that they actually let it pass. And there's a couple markers that are going to come up that will be incredibly difficult for the Liberals to get through, which we will talk about in the second. Why don't we just share these polling results? I know not all of you have voted, but interestingly, it's actually a little bit split here. And I think the reality is nobody knows. The big vote is on the budget. They could get to the fall. I'm very fascinated to see enough people thinking that it could last until 2022. This is a really odd one. It's hard to read it during the pandemic. It's hard to read the predictions, but at least we know the markers on when the likelihood could increase. And that spring budget is likely going to be it. And I would imagine that budget would want to come before tax season comes in place. Ian was talking with about that with us yesterday, and we'll talk about that in a second. So what do you need to focus on? Pre-budget consultations. Federal Finance Committee is finally getting moving. I'm going to be really honest. I know a lot of people spend a lot of attention on the Finance Committee pre-budget submissions. I'm not convinced they're as important as people think they are. It's a process that we do every single year, and not to say that you shouldn't do it. A lot of the time we're caught in a catch-22 because the government says, well, have you submitted to the committee? And you kind of feel like you have to. I think that the work you do between getting that committee submission in and when the federal process kicks in for budget planning, that's really the work you need to do. So the committee is a tool to make sure that we have succinct budget asks, but the target of the audience you're going after isn't necessarily committee. It really is the work you're doing to get in with bureaucrats and the government between that budget committee and between that and when the government launches their own consultation, which is likely going to be imminent. We know that they'll have that normal pre-budget consultation. And inside government right now, you will have your bureaucrats writing their proposals for the departmental budgets to the minister. The minister will review and approve that, and then you'll have the letters going into the Minister of Finance. And it's tough getting money if you're not in that letter from the minister to the Minister of Finance. And that process is happening usually before the government actually announces these pre-budget consultations, the government-led pre-budget consultations. So it's a bit tricky. Those on this call who have done this before are aware of those nuances, but we're more than happy to talk to you about that because it's not an easy one to assume the answer to. It's likely there'll be more response to COVID-19 and provinces will continue to ask questions, and the federal government has contributed the most money, and you would expect that they will continue to do that. The only new policy that we can expect launching in a big way is the strategy around high-cost rare drugs. And then the national long-term care standards, what the government committed to in the throne speech. I think a key question, looping back to the FPD discussion, is if these standards will be part of government funding conditions. So we're sitting here now in December. January 1st, PMPRB regulations come into place. A massive thing for the pharmaceutical industry, who have been focused on these for the better part of 4 or 5 years. It hasn't really caught the attention of the public. There's a couple court cases ongoing. In fact, one of the court cases has impacted the government's ability to fully implement these regulations. I don't think you're going to see this one going away anytime soon. You might be for this, you might be against it. And in either circumstance, I don't think it'll be going away. It's kind of like one of those ones that's going to simmer in the background because it's truly is a strong stakeholder issue that's complicated and hasn't caught fire in the public. Doesn't mean it's going to go away. Parliament will come back, committees will come back. There's a couple committees that are happening, whether it be COVID, PMPRB, finance committee on the budget, spring budget, a dynamic tax season, March, April. The big concern for the government is a lot of people are going to be asked to give money back through CERB. And one of my colleagues flagged that I believe CRA is even sending out missives saying pay in December if you owe, it'll be easier for you. And then the big marker in August is if the majority of the population has had access to their COVID-19 vaccine. So key takeaways, let's have some questions. Vaccine rollout is the real test. I think this federal government is coming from a position of strength. The reality is they're polling well. The opposition hasn't really landed a cohesive punch on them. And the opposition, they're not working together the same way they were when they could rally around COVID-19. So these COVID studies are dragging out despite the document dump. I'm actually surprised how easy it is on this minority government, to be honest. And the provinces have a long list of health needs. And I think there's ample room for these governments to come to an agreement because there's just enough things that they can discuss. So with that in mind, I'm going to leave a polling question up on here because I'm curious to see everybody's responses in terms of how you think they managed the pandemic. You can choose more than one response. I might have another poll on here, but why don't we stop here? Hannah or Ian, any thoughts from you? And then perhaps any questions that kind of feed themselves in, now's the time.
Yeah, I mean, one point I think we just all need to be thinking about as we go into the new year is, we talked about the challenges from wave 1. We know there's going to be additional challenges from wave 2. And the federal government's really going to have to deal with, responding to those, say, post-pandemic after the vaccine rollout, hopefully is successful, knock on wood. Deal with that. And at the same time, deal with the, volatility of a continued minority government and potentially a general election. So, all to say it's a bit of an obvious statement, but I mean, 2021 will be in many ways, even more dynamic and interesting to see than 2020. And, I think for the healthcare system overall, and at Santis, we've talked a lot about this concept of, will there be a sort of a federal government Marshall Plan, almost post-war response to the health system in terms of increased investment. And, I think the pandemic has shown where the cracks are in our healthcare system, and that kind of, there are challenges with FPT jurisdiction, but there's been a lot of reasons for increased investment and support from the federal government going forward. So it will be really interesting to see what kind of recovery measure post-pandemic potentially is put forward.
I think Ian, part of the challenge is the challenges are just so big and so many of them. I don't think governments know where to start. Kind of going back to that other polling question, like what would you, if you had to choose one thing, what would it be? And to use an infamous Stefan Dion quote, do you think it's easy making priorities? Right now, it's pretty hard because everything's an issue to somebody. And trying to figure out what part of the healthcare system you want to tackle isn't an easy thing. And as much as, money is a solution, it's not a silver bullet. Just by the feds giving money to the provinces doesn't mean anything's tangibly going to happen. And kind of looping into a question, Manny, which I agree with the comment. If the real test is the vaccine getting through, I think there's a lot of risk to this government if they do go beyond the spring in terms of an election. You get past that, and all of a sudden you have a government that has to roll out $100 billion in stimulus. They have to face a challenging tax season. They have to be held to account in a vaccine immunization program. It's kind of interesting to think that we simultaneously have a federal election and the largest immunization campaign in the history of the country happening at the same time. And then even if you look in the past week, the government's going to keep getting hammered on decisions they made in the early days of the pandemic. Because we might recall that in the early days of the pandemic, they didn't have a lot of information and they're flying off the seat of their pants, and we were pretty forgiving of that. We're going to forget that in a couple months. We're going to forget how quick and how little information the government had to make decisions. And it's going to sound silly that some things that we decided to do March 1st and then what it looks like in March 2021. And whether the government likes it or not, I think it's going to hurt them. And I think it's going to hurt all governments because of that. It really sucks sometimes to be government. So I'll share the results for this poll here. And if there's no more questions, we'll wrap up after that. Interesting to see that most people are rather forgiving of the government. The one thing I would say in terms of the pandemic has exposed the limitations of the federal government's ability to move fast. They did do CERB shockingly well, but they did it well because they did not have any accountability measures in place. They decided we'd deal with it later. The federal government still deals with everything in paper and has for the longest time. When you write a letter to the government, that letter is typed up, put on a piece of paper, and then shipped around for approvals in a docket on paper. It sounds so backwards and it sounds so archaic, but the federal government generally operates on paper. So the fact that they have had to adapt to everybody working at home and keep the secure system, the reason why they use paper is because it's more secure than everything electronically. It's pretty astonishing, but the federal government's a pretty old system that they need to probably address. One question here: the Conservatives abandoned the foothold as the party that can manage the federal deficit post-pandemic. I don't know. Ian, Hannah, you want to tackle that one?
Yeah, I mean, I don't know. It will be interesting to see going forward, right? Because I do think in many ways, you know, what is fresh in Canadians' minds, regardless of partisanship, in terms of the voters you're going after, pretty much for all Canadians, what's fresh in their minds right now is, you know, there were the significant unemployment from COVID, the challenges that Canadians have had to deal, even if they've remained employed, with childcare at home. All of these things translate potentially into more cost and support from government. And I do think for a lot of Canadians, even Canadians who voted Conservative in the past, they may be looking to increased investment from the federal government in some of these areas. So I do think it's going to put some pressure on the Conservatives to think a bit differently in terms of their past position on spending. And but at the same time, I mean, they're, you know, they do have a base that you know, that still sticks by certain positions from government, and I you know, in some respects that's not going to change, but I do think that they are going to have to change their messaging and support on some measures, particularly things like childcare, where we've seen a lot of pressure coming out of COVID, and it may well make some changes for the party if they want to be competitive in the next election.
We had another question come in on the chat. Do we think the Liberal government was, to a better extent, helped or saved by an inept U.S. response? I actually don't think we're that much different than the U.S., or we're more similar than we'd like to admit. In terms of the big guidelines and in terms of the big things that need to be done, the U.S. was actually ahead of Canada on some of those from a federal government standpoint. You know, closing down the borders, they arguably did a better job working with companies to produce vaccines. The only caveat I'd say there, it's all a big bet, and the government of Canada just made more bets, and we're in a very fortunate position with the Pfizer vaccine. I think that one was more rolling the dice than anything. Even some of the dynamics around resisting restrictions to protect public health. Alberta isn't so different than a lot of states down south. The biggest difference is the sheer independence and division between the federal government and independent states, and the ability to coordinate between 50 plus states versus provinces and territories, the 10 provinces plus the territories. In some extent, I actually think we have an easier job and an easier system to navigate that way. It probably helped Trudeau that it was just Trump, frankly. If it was anybody else, I actually think that we'd be viewed right in line with the United States, because I actually, aside from just the ridiculousness of the communications coming out of the government, things that the CDC and the FDA have done are pretty similar to what Health Canada and FAC had done. Okay, I'm gonna unless Ian or Hannah have any other final thoughts, I don't see any more questions coming in. So we'll wrap it up there, and thanks everybody for joining. Go on to the chat and fill out the survey. Hope to see you in the new year. I hope you all have a fantastic holiday and enjoy some time with your loved ones in your bubble, that you're all safe, you're all healthy, and that we'll see you in the new year. Feel free to reach out with any additional questions.